I started to notice that I had a pain in my leg and it came from my back, and I mistakenly assumed it was sciatica because I'd started to feel like an old woman. I was limping, I couldn't walk properly, wasn't enjoying my life, and I wanted a better quality of life. And then I got to the point where I just couldn't carry on, and until I had an x-ray, I was completely shocked. I never dreamt it was my hip. Within 2 weeks of the diagnosis, I was seen with Mr. Kim, and within less than a month, I actually had my hip replaced. When I went to the Alex, it was a very friendly and warm experience. And when I sat with Mr. Kim, the combination of knowing I was going to go into the Alex and to have him as my consultant, and also to have his robot to assist his procedure, gave me total confidence.
The MAKO robot system has provided surgeons with so much more information than was previously available to surgeons. And it combines 3D technology with CT imaging to allow the surgeon to construct a surgical plan even before surgery. What happens is that during surgery, sensors are placed around the joint, which allows the software and the robot to detect that joint in 3 dimensions. And the robot arm has this capability of making cuts that are precise and accurate to fractions of millimeters.
It was a tool for Mr. Kim. It was about precision. It actually meant that there was less damage to my soft tissue, there was less damage to the actual removal of the bone, and it meant that I would actually have a totally tailored joint replacement, which would mean I'd have a better joint. It probably is a better hip than it has ever been, and that's because of the precision of the robot. On each occasion that I went to the Alex, I had to be on my own. So it was the reassurance I had when I was actually going through the pre-assessment. And everybody was pleasant, warm and helpful. And what was really important, nothing was too much trouble. They put you at the heart, you were the patient at the heart of it. It wasn't that it was being done to you, it was being done with you. Martin pops up on the physio, so we're having a Microsoft Teams telling me what to do, and I'm doing my physio activity, and I know that I'm supported. I know that I can ring the physios, I know that I can ring the hospital if there's anything that I need, because it's not a case that your operation is done and you're out the door. It's a case that they're supporting you back to full recovery, and they celebrate that. And now I walk, I have no pain, and I've got life to look forward to, and that's what the combination of the Alex, Mr. Kim and his robot has given me, and I know that, and I wouldn't hesitate to recommend this to anybody. I've lived it, I've done it, I've been there.